So hello everyone, and my name is Helen Hurst and I'm the Chair of the Trust, and I lead the Board of Directors and our Council of Governors, and it gives me great pleasure to welcome you this evening to our annual members meeting that's been held online. And this meeting covers the period from the 1st of April 2021 to the 31st of March 2022. The eagle-eyed amongst you will have noticed that my appointment didn't actually start until the 1st of July 2022, so I can't take any credit for any of this at all, and I'm going to try my best to channel my inner Philip Lower, who was our previous chair and who, had he not been in the sky above us at the moment on his way back from Spain, would have been here to join this meeting. So I hope that by this time next year we're able to have a more engaging event where we can all meet and sit in person and do a normal annual members meeting. But for now, we will make the best use of the technology that we've got available and try and be as engaging as we possibly can. I'm just also going to give a little plug. So hopefully you've noticed that I'm wearing a nice bright pink jacket, and this is in recognition, this is the colour of Organ Donation Week, which is this year's theme, as well as wearing pink, is to make sure that if you are wish to be an organ donor, that you let your family know and you take that difficult decision away from them if that time comes. So please, any of you who are wondering about that, please look at the resources that are available and try and let's make Organ Donation Week a success this year. So it's great to have you all joining us. We've got governors, we've got members, we've got colleagues, we've got exec, we've got non-execs, we've got a whole load of people here joining in with this annual members meeting. Thank you to those of you who have sent questions. We will aim to finish this meeting by 6:30. If in the event we run out of time for any of those questions, please be assured that we will send you written responses, and that includes any questions that get asked during the course of the meeting. So as I said, we've got a number of colleagues here, and I'm just going to put up some pictures just so you can see who's who. And the first picture, there you see the lovely faces of our executive team who are on this slide, and on the next slide you will see equally lovely faces of our non-executive team. We do also have some similar pictures for our governors, but Stephen Baines, when he comes to his slot, will share that. So I'm not leaving you out, governors, those of you who are here. So other people just to welcome, I'd like to welcome our external auditor, Rick Lee, who has joined us today. And our external auditors play a vital role in auditing our annual report and accounts each year before they are submitted to Parliament. So you can see what the annual reports look like on the screen. They're summarised. We'll get some summary of some of this information this evening, but you can find the full versions and an easy read short version on our website if you want to look into this in further detail. We also publish our quality accounts, and they can be found on the website as well. And these describe the quality of services that we've delivered to our patients over the course of the last year. So I'm going to move on now to just talk about the order of events and what you're going to can expect during the next hour and a half. So after I've finished, I will be handing over to our lead governor, Stephen Baines, who will talk through our governor activities for the last year. Our governors, both public, staff governors and representatives from partner organisations, play a really key role in the Trust and its governance arrangements, and he will tell you more about the work that they've been doing. We're going to also hear from Renee Comerford. Renee is a nurse consultant for elder people, and she's going to talk to us about the work of the frailty service, both in the hospital and in the community. Our employability manager, Liam Whitehead, is going to talk through our widening employment programme and give us a small presentation on that. And then our Deputy Director of Finance, Kirsty Archer, will cover the formal business of the annual report and accounts with a review of the last financial year, along with Rick Lee, our external auditor, as I mentioned earlier. We'll finish off the formal presentations with Brendan Brown, our Chief Executive, who will give us a bit of a summary of where we've come from and give us a particular view on it, where we're going in terms of the rest of the year and beyond. As I mentioned, we'll have a dedicated question and answer session at the end, where we will try and respond to any questions that come in during this meeting, but also the ones that have been sent to us in advance. Now, there's just one or two little housekeeping rules that I need to do. So just for your information, everybody in this audience is muted so we can prevent background noise. We're not trying to silence everybody. It's just to be able to manage the meeting. We're recording the meeting so we can share it on the website afterwards. And for the question and answer session, once we've responded to the questions, as I've said, if there's any more time, we will take any questions raised during the meeting. You can raise a question by typing it in the box with a question mark on the screen. And for any questions that we receive, we will try and answer them, or we'll deal with them outside the meeting. So if your name is visible on the question, please do. And somebody is checking those questions as they come in. So before we move on, I just want to firstly acknowledge the work and dedication of our outgoing chair, Philip Luer, who I mentioned earlier. Philip retired at the end of June after 4 years as our chair, and he had great admiration and deep respect for each and every member of the CHFT family and for everything that they did to deliver compassionate care for our communities, particularly over a second really challenging year of COVID. In the annual report, Philip shares how he was filled with pride as colleagues went the extra mile to support patients and each other despite the pandemic and the relentless, never-growing pressure facing our services, with colleagues weathering the toughest of storms together with unshakable dedication and professionalism. With the recent passing of the late Queen Elizabeth II, we're also reminded of her recognition for the NHS, shown by the award of the George Cross on the 4th of July 2021. This is only the second time this highest civilian award for gallantry has been given to an organisation, and the late Queen's letter noted that the award was given with great pleasure on behalf of a grateful nation, recognising all NHS staff, past and present, for their role in supporting people with courage, compassion, dedication and public service, particularly during the pandemic. And we thank her for this award, but also for her life that was absolutely dedicated to public service. So back to Philip. Philip would like to be sandwiching the Queen, wouldn't he? He'd really like that recognition. And he steered this trust through a COVID storm and its aftermath. In our annual report, he highlighted the pioneering work of the trust on inequalities, its commitment to working with our partners across the region, and our ambitious reconfiguration and transformation plans. As I joined the trust, I do so as the NHS landscape changes again with the Health and Care Act, a new set of measures that are set out in legislation designed to make it easier to deliver integrated care for people who need our services. And we'll hear a bit more about that later from Renee. In some ways, the legislation is catching up with the reality, as our colleagues already work in partnership, whether they be with primary care, with community services, with mental health services, with the community and voluntary sector. There are some changes in governance with the establishment of the integrated care boards, however, and its place subcommittees that do bring changes that will affect the trust. These changes also bring opportunities to do even better. And as Philip said, we've done great work on inequalities. There's so much more opportunity now working with our partners in Kirklees and Calderdale to do even better. Those of you who are interested in the work of West Yorkshire Health and Care Partnership and those governance arrangements and those changes, there's a really good website available that you can go and you can find anything out that you need about the partnership, the new integrated care board and the new integrated care system. I spoke to Philip last week when I was preparing what I was going to say on his behalf, And I said to him, you know, if you were there, Philip, what would you be wanting to highlight? You know, obviously we've got great service innovations, we've won national awards, and we've got amazing colleagues who go the extra mile. And he said, well, this is the thing I've always, you know, been really keen to understand more and have really enjoyed hearing about were the people who won our staff awards, because it gave me real insight into those who go that little bit extra. And just to pick on a couple, and I know there's a monthly star award and I'm only picking on two, but two that stood out were, one winner was a porter who turned detective when an elderly patient's mobile phone was accidentally swept up in their bedding when it was changed, and he managed to track it all the way back to the laundry cages deep in the basement and found it just before it had ended up in the washing machine. So just, you know, just that little bit extra. Another award went to a sister on the cardiology ward who, as well as taking time to explain procedures so well to elderly patients, was also a star during the recent heat wave, making it her mission to give out ice lollies and ice cold drinks to keep everyone hydrated so that nobody missed out. So I think, you know, it's important to recognise that a lot of our colleagues go the extra mile, not all of them win the award. And so, you know, recognition for all those who have been submitted for awards as well as those who have won, and a little plug for our CHFT awards coming up shortly. The other thing I just need to draw reference to is there wasn't just Philip left the board, but we had two new non-exec directors and which two non-exec directors left. So our new non-exec directors that were appointed by our governors were Tim Busby and Nigel Broadbent, and I think they are on this call today. I've certainly seen Nigel's face. We also said a fond farewell to two non-executive directors, Alistair Graham, who left the trust in May, having been the first chair of our subsidiary Calderdale and Huddersfield Solutions, and Richard Hopkin, who was our deputy chair, who had served nearly 7 years, and we thank both of them for their service. So I'm now going to hand over to Stephen Baines, and Stephen is going to talk about the governor activities over the last year, and I think the slide is up and ready. So over to Stephen. We may have our first little hitch here. Okay, so while we're waiting for Stephen, when Stephen's finished, he's going to hand back to me, and I'm going to talk about some of the governors whose appointments have been extended, just so that you're all informed of those. So, given the operational pressures that we had in the months prior to the elections, we were able to extend the tenure of some of our governors, who very gratefully for them that they were able to do an extra term. Now there is a slide of those governors, but I'm not sure, well, of course it won't come up because we're not in that order, and they will come up shortly. I'm now going to ad lib. Unfortunately, I can't dance or sing or do anything like that, but I have now seen that Stephen is back on and live. So I'm going to hand over back now to Stephen Baines.
Right. Thank you, Helen. Hello, everyone. I am Stephen Baines, and I have been the lead governor at CHFT since December 2019. Firstly, I would like to take this opportunity to thank all the governors for their continued commitment to the Trust over the last 12 months. The next few slides show our current Council of Governors. The next slide, please. This slide shows the current publicly elected governors. Next slide, please. This slide shows our current staff elected governors. And next slide, please. This slide this slide shows our current appointed governors. Thank you. Having been a governor for several years, I know my fellow governors will agree with me when I say it is a real privilege to have a close connection with the Trust and see how well colleagues across the organisation, both in the hospital and in community in Calderdale, have coped with the challenges of the last couple of years, 21-22. Has continued to be challenging, with COVID waves continuing to affect both patients and colleagues across the Trust, working hard to treat patients whose care was delayed due to the pandemic. During this time as governors, we continued with virtual meetings, and I would like to thank the governors for their continued engagement during the past year, as they have made it a very successful one, showing the commitment we all have in our roles as governor in supporting the Trust. The prime duty of the governors is to ensure that our non-executive directors effectively challenge the other board directors in all matters regarding the work of the Trust. We do this by attending the board meetings, the board's committees, and with non-executive directors attending our Council of Governors meetings, where they report on their work and answer governor questions. We had a very busy year supporting recruitment to key roles on the Trust, including the appointment of the new Chief Executive, Brendan Brown, who rejoined the Trust in January 22, and the appointment of a new Chair, Helen Hurst, who worked with our outgoing Chair, Philip Lower, as he handed over the baton. I would like to formally thank Philip Lower for his contribution to the Trust over the 4 years as Chair, and his legacy of a very positive working relationship with both myself and lead governors. The wider Council of Governors and the Trust, on behalf of patients, we look forward to continuing to build on this great foundation as we work with our new Chair, Helen. During this last year, governors had opportunities to attend workshops with the non-executive board directors to discuss many areas, including cancer performance, how the Trust is reducing health inequalities in our local population, the nursing and midwifery strategy, the Trust's strategic objectives, choosing the quality priorities, and the development of the integrated care system. Last autumn, the governors have also appointed the Trust's external auditors. Given the operational pressures, governors received information from clinical divisions about services via virtual meetings and were pleased to resume meetings in person in June 2022. During the year, we extended our membership community by broadening it beyond Calderdale and Kirklees for those interested in our hospital who live in different areas. We welcome the new members. This will also support engagement with partners across our regional West Yorkshire integrated care system. Each governor now shares our newsletter, Foundation News, with our members and encourages feedback from members. As governors, we are keen to engage further with members and the public in our constituencies. A small group of governors has begun work planning activities following a survey of our membership and what they would like to see. If you have any questions about this, please do get in touch. We welcome ideas from our members about how governors can best engage with you. Please send us your comments via the membership page on our website or complete our membership survey, which we will be sending out soon. A couple of our governors and members continue to assess patient experience using a tool called Observe and Act, focusing on inpatient care to look at where improvements could be made for patients. Again, we are now able to undertake this in person and look forward to continuing this over the next year. Over the last 12 months, the Trust has exciting plans for the new developments across both of its hospital sites and in the community, which you will hear about during this meeting. We look forward to working with the Trust on these and sharing our progress with our constituencies. On behalf of the governors, I would like to thank Andrea McCourt Amber Fox, Vanessa Henderson and Daniel Booth from the Trust corporate team for their help and guidance, as well as Philip Lure for chairing our meetings and our other non-executive directors for their updates and work during 21-22. I would now hand you back to Helen. Thank you.
Okay, thank you. So as I mentioned during my ad lib moment, we have extended the terms of the governors, and hopefully their slide with those who have had extensions are up there. So they all very grateful for them to agreeing to continue in their roles. And just to endorse what I get Stephen says, I think it's the first time I've worked with governors in this role as chair, and I have to say it's one of the most exciting parts of my new role. They're a gift, I think, to an organisation, that you've got volunteers who are committed and to bring their energy and their expertise to help us provide better care for patients. So thank you to Stephen and all of the governors who contribute and add so much value to the work of the trust. So I'm now going to hand over to Rennie Comerford, who I mentioned earlier, and she's going to talk through a few slides about our frailty service, both in the hospital and in the community. Over to you, Rennie.
Thank you, Helen. Good evening, everybody. My name is Renee Comerford. I'm a nurse consultant for older people, and I'm also a clinical lead for the Urgent Community Response Service and the Virtual Ward Service, which I'll describe as my presentation goes on. I think it's only appropriate, though, that we take a moment to reflect on the impact this pandemic has had for all of us, but especially for our older and frail population. We all found this really quite extremely difficult to navigate around, but I'm also really proud about how our teams worked well and are still working well and trying to navigate through them challenges to ensure that we deliver the best care. And I think that's something we absolutely must recognise. We recently lost our Queen at the grand age of 96. The guidance was no different for her. We all witnessed her burying her late husband alone. But it was also clear that our late Queen and her husband had excellent plan of care in place throughout her life and his life, and actually they had a voice in what they wanted to happen at the end of life as well. This is something we aspire for all our older and frail people going forward, that actually they have a voice in their care, because that's what we want. We want them to actually be able to plan their care. So how have older people services evolved over the time? Historically, when older and frail people became unwell, they were sent to hospital. However, evidence now shows us that actually this isn't the right thing to do. It can cause more harm by conveying somebody who was old or frail or vulnerable to hospital. And the reason for that is when we do convey somebody, so just putting somebody in an ambulance can cause something such as a delirium. This can lead up to, well, an increase in mortality by 25%, which is high. We know that when people come into hospital, they do decondition because they're not in their own environment. So bringing people into hospital is not the right thing. So we need to look at how we deliver care closer to home. In 2017, we were fortunate to receive some funding to set up a frailty service. This enabled us to change the way that we care for our frail and older population. And it was clear from the offset the benefits, not just to patients, but to carers. Having that holistic approach to how we care for somebody was something different to what we'd ever done before. When somebody used to present to the emergency department, we don't just look now at what somebody's presented with, we look at what's been happening over the last year or 2 years of their life, not just reviewing that medical condition, but looking at the social aspect, the environment, the functional ability, and actually making sure that we're addressing all elements, because these people are quite complex at times and that there's quite a lot going on, but actually we need to address every element. But what's really important as well, that we look after carers, because them carers are looking after these people at home. If we don't look after them, then who's going to look after them? So we don't want them to present in crises. That's really important. Nationally and locally, it was recognised that we need to ensure the right services involved when somebody requires an urgent community response. The importance of how we collaboratively deliver this is key to better outcomes. Reduce unnecessary conveyances to hospital, and reactive and proactive care does and should interface to provide the excellent care. I will describe it later on in the presentation how we've delivered this through urgent community response. What we did do, though, was start with an integrated vision back in 2017. We were really clear across CHFT and different our partner organisations that we wanted to do something quite radical to be able to care for these people. It gave us opportunities to work differently, stepping away from trying to deliver care where the patient had to come to our services. We wanted to be able to deliver that care and take our service to them, because actually we recognise it wasn't right for them to be coming into our busy ED departments for that care. Older and frail people conditions present in a multitude of ways, and we want to make sure that we address everything to enable them to live well, and they can live well with frailty, and we can prevent some frailty. That's really important. We signed up to a vision together across different organisations, and we agreed that we would not make things difficult. When we wanted to make change, we made that change, and we stepped outside of them boxes, because people aren't in boxes, and we wanted to make sure that we delivered personalised care. And that just describes some of the multidisciplinary team that's involved in this team. And it is high level, and it is a big team delivering this service. Do you want to just go on to the next slide, please? So the frailty service has evolved at pace over the last 5 years. We aim to provide what we call a comprehensive geriatric assessment, which is a holistic assessment within 30 minutes of somebody presenting to an assessment area. So that's quite a high expectation, but what I would say, we deliver that within 90% of our patients coming through our doors, which again is outstanding. It's that holistic approach, like I said, but what this has enabled us to do on the back of patient feedback and some of our data that we've collected is actually the ED part, the emergency department is not always the best place to care for these patients. So what we have designed now is a frailty same day emergency care. So they will be streamed quite quickly up to the same day emergency care. And again, we've got that full multidisciplinary team that will help support them to enable them to go back home. If they do need to come into hospital, they stay under our care for while they're there to help to facilitate them to go home with the right support in place. We see an average of around 800 new frail patients a month and around 1,400 follow-ups. The data shows there that actually we've reduced admissions into hospital, we've reduced readmissions. Our service is not just around reducing admissions, readmissions, it's about the quality aspect. Reducing readmissions means that people in the last year of life or the last few years of life are not going backwards and forwards between our services. We're able to care for them, deliver that care close to home, and we're able to facilitate that care at home. Let's go on to the next one, thank you. So Urgent Community Response is a new service that we started last December. And it's aimed to deliver a 0 to 2 hour response for anybody aged over 18 and accelerate that treatment of care at home. It also provides a 0 to 2 day element where we can provide that ongoing care as well. It integrates really closely with our discharge to assess pathways, enhanced health and care homes and anticipatory care and the frailty strategy. It's a community response is a collective name for services that improve quality and capacity of care for people through delivery of an urgent crisis response within 0 to 2 hours. The overarching aim of the urgent community response is to enhance patient experience, prevent unnecessary conveyances, and if they do require treatment, that we stream them to the right place so we can take direct admissions into frailty same day emergency care. We are of the we have a vision that we no wrong door approach where whoever comes into our service, we sort that problem out. We don't pass on to different services and we don't make it fragmented. This is a huge development in our community services, probably the biggest in the last decade. Whilst we already have existing services that respond to urgent needs in the community, both health and social care, these services had been fragmented and working in isolation. The urgent community response has aligned services across community and other organisations to ensure people are cared for timely and they're having the right response. This has brought health and social care together, enabled us to create new roles. Next slide, please. The virtual ward, or sometimes known as hospital at home, is to provide safe alternative to hospital for people living with, well, we're starting off with frailty and respiratory, but it will lead to all conditions. And this is a service that's going to be up and running within the next month, but will be closely aligned to our urgent community response, because what we want to be able to do is when we do go out and we get a 0 to 2 hour response, or the GPs refer into our services, that we can wrap around that care and deliver that care and keep them under the same team. So when somebody's under us in frailty and they stay under us in hospital, that'll be the same at home as well. And it'll be the same multidisciplinary approach to be able to deliver that as well. So it's central to the approach of in services working towards providing a model that's patient-centred, in which the home is an option for care. This is part of a shared decision making in line with personalised care principles. A hospital at home for frailty should be available for option for all clinicians to refer adults aged over 65 with an acute exacerbation of frailty related conditions. Like I said, the virtual ward is aligned to the urgent community response service to enhance that service. New roles are being created for this to evolve. And I think that's the exciting bit, because we know the NHS does struggle with recruitment and retention and everything else at the moment due to lots of pressures and lots of other business. But actually, this has enabled us to work together, and we've been able to create new roles. So part of the urgent community response and the virtual ward service will have something called a night sitting service, and it'll enable us to keep people at home. And when people need that extra bit of support overnight, we can put that in. It's also enabled us to work really close with social care and put in other roles, so that what was predominantly a social care role before is now coming to a health role, and we can do blurred boundary work and to deliver that care. So what's next? So we've now, which is really exciting, we've got ageing well practitioners working across every primary care network now, and they work with primary care, social care, voluntary sector, proactively supporting people and identifying people early on to help them live well with frailty and age well. And that's really important, that we're starting to actually really focus on that proactive arm, so we prevent people presenting in crisis. Education and training is key. Frailty is a long-term condition. Older people are aging and living longer, so we need to enable people to be able to care for them. We need to ensure everyone can access services no matter who you are and where you are and where you live in. Health inequality is key to this, and we need to make sure it's accessible for everybody and that every pathway is easy. And that's when we talk about a single point of access for urgent community response in the virtual ward. It's got to be easy. Pathways are great, but recognise that pathways sometimes can create delays as well, and it can be difficult to navigate through. So again, we've got to make that easy. And we've got to have opportunity to develop new roles within this care. Your involvement is key, and that's why patient experience is key to how we deliver this going forward. And I think we've learned a lot from the frailty service, as in we don't just gather patient feedback from surveys, we have patients and carers that walk through our service often, and we invite them into walk around, especially pre-COVID. We've had days where we've invited, whatever we've done with the service, we've brought them in and involved them in actually what would you want different for yourself and for your family member, and that's enabled us to move and develop this service and provide the outstanding service that we've got today. It needs to be evidence-based and give us opportunities to research, and I think that's really key. So all the good work that we're able to do, we need to be able to share that going forward. It's exciting times ahead for our frail and older population. Calderell and Huddersfield Trust, in collaboration with community, mental health, social care, voluntary sector, and especially our patients in care, will play a key role in using national linked data and research to develop an outstanding older people and frailty services across the acute and secondary care. We need to plan ahead, continue to look at the gaps, and I think that's really key, that we identify our gaps and what's not working well, and we work together to be able to deliver that. And I think something that we should be really proud about with our frailty services, pre-COVID and even during COVID, our readmissions were probably one of the lowest in the country. And that's not just, that's a collaborative approach, isn't it? Because we were able to care for them no matter where they were in the different organisations, and keep them at home or wherever that might be, wherever home might be, and provide that really good care. So I think we should be really proud about that. Thank you. And I'm going to hand over to Liam now. Thank you.
Thanks, Renee. Good evening, everyone. My name's Liam Whitehead. I head up the Apprenticeship and Widening Participation Service here at CHFT. So just as a brief overview of what we do as a team. So we were established around about August 2001. And what we've managed to achieve in the last 12 months has been fantastic. Got a really passionate group of people who are working on a range of different activities, and what we've done is develop a range of new pathways, new entry pathways and progression pathways into the trust, and we're also currently connecting those pathways into our current apprenticeship offer. So as a team, we reach out into our local communities even further to try and discover new talent. We're also delivering a range of different employability interventions, not just for new entrants, but also for some of our internal colleagues who are seeking development. And we also deliver our own in-house healthcare support worker apprenticeship programme. So I'm lucky to manage a team of really passionate assessors who put one culture of care at the heart of everything they do. So today I'm just really excited to bring some of this to life and to showcase some of the array of projects that we've developed from scratch over the last 12 months, showcase the impact in terms of the difference it's made to real people in our localities and our patients, and to demonstrate as well how effective some of our partnerships have been, because without that collaboration into the wider system, we wouldn't have been able to reach out further, especially to support those hardest to reach and hardest to help. Next slide, please. So as you can see, there's some familiar organisations that you might be aware of. So over the last 12 months, the team and I have cultivated some really good links with some organisations, and what I want to do is just pick out one or two of those organisations and bring that to life a little bit. I did mention previously that we have supported some of our internal colleagues, so I'll start there. So Realise are a training provider that we've recently partnered with. So they deliver maths and English qualifications. So what we've managed to do is tap into their adult skills budget, and we've had over 90 colleagues now accessing free maths and English functional skills subjects, as well as digital skills. So the impact of that will be felt within the next few weeks and months, but that will definitely support some of our colleagues who are looking at progression and development. Next slide, please. So I'll start with the Prince's Trust. So you're probably aware of the Prince's Trust, and that's something we launched in November 21. So working with a range of partners to get a range of different referrals in, we created our Get Into Care programme, and so far we've had over 40 applicants since November. So what applicants get to experience is 4 to 6 weeks on our wards as ward helpers. So it's almost like a working interview. So what we tend to do with those applicants are give them that full rounded experience of life on our wards, supporting our nursing colleagues, and more importantly, supporting our patients. The applicants come from a variety of sources, including the Job Centre, CK Careers, and are made up of mostly younger people aged 16 to 30. So far, out of the 40 applicants, we've had 12 successful progressions into our clinical healthcare support worker apprenticeship programme. And there has been some phenomenal stories, some people who have moved across from different countries who have joined this particular project and are absolutely flying on the wards and doing brilliant work. The next example is St John's Cadets. So we recently set that up in January this year. So 3 days a week, we have 70 young people aged 14 to 19 access our services after hours, so after 5:30. 30 of those are volunteering across 25 wards. The rest of the students are undertaking personal development programmes. So we support that through a range of employability interventions, and we also bring some of our CHFT professionals to come and speak to the group of young people. Kickstart is another really successful partnership between the Department of Work and Pensions, the Job Centre, and we became a gateway provider back in November. We interviewed over 60 applicants in the Job Centre, and we recruited 20 local young people who had been unemployed for 2 years into a variety of clinical and non-clinical entry roles. We had 70% of that cohort remain with us, and they've progressed into apprenticeships and substantive posts. So you can see Anya and Emma, who have joined our team and again are doing brilliant things. And there's another example there of Catherine, one of our volunteers, who joined our Care Club volunteering project recently and is looking to apply for our next apprenticeship cohort in October. Next slide, please. A recent piece of work is we've undertaken is with the Job Centre and Kirklees Local Authority, and that's something called a sector-based work academy. In a nutshell, it is giving people the opportunity to have a working interview. So rather than jump through all the hoops around recruitment, we support them over a 2-week intensive employability programme. So these are adults aged 18 right up to 65 who are looking for their first steps into work, long-term unemployed for 2 years. And what we do is support the council with that employability input, and then we offer a working interview via placements. So we've developed a particular project with our colleagues in domestics. We had 20 applications, 11 went on placements, and we've successfully offered opportunities to 9 local residents. One person was aged 68 years of age who had been looking for work for 3 years, and another person had recently come across from the Ukraine and have just started on our domestics team. The other project that is long-standing is Project Search. I just want to give you a very brief update with regards to last year's cohort. So there are 10 young people, each with educational healthcare plans. 5 have progressed into employment with us at the Trust. Next slide, please. Finally, I just wanted to bring some attention to some of the other activities that we have done as well. So we've also supported previous volunteers coming back into the Trust. So there you can see a picture of our League of Friends colleagues who have recently come back as a result of COVID restrictions being lifted. There is Chloe, one of our apprentices. She was part of the first cohort who did our TNA apprenticeship pathway. So she's come straight through my apprenticeship programme and onto the TNA pathway, and she's going to qualify as a nurse in January. There's Tom, who's progressed from one of our aspirational visits that we set up during lockdown and has now started a non-clinical apprenticeship in the medical secretarial team. And we've also relaunched Work Experience from April this year, and we've had 150 students come back on board, and we're looking to grow that significantly next year. So just to finish, really, we've got a lot of new things coming in. So we're doing a lot of work with Calderdale Kirklees College, creating a T-level health academy, and we're going to tap into the talent that exists in those colleges and hopefully scale that up and get more people from college into volunteering and paid bank work. We're also going to look at a new pathway for Prince's Trust non-clinical, and we're also going to develop the sector work-based academies. And just to round it all together with the final slide, just to give you some very quick headlines. So 50 local young people have accessed apprenticeships and employment outcomes as a result of our pathway since November. We've reached out to over 4,000 people. 96% of those have been aged between 14 and 30, and 56% from underrepresented groups. 29% have disclosed disadvantage indicators, and through our volunteering projects, we have recruited 121 into our project since November, but total since then we've supported 202, so that includes existing volunteers returning. We broke down barriers, we've tried new ways of working, we're all constantly looking at new models to recruitment, so that's an ongoing piece of work, and we wouldn't have been able to do any of this without kind of opening our doors and having that collaborative approach to a range of partners. So thanks very much everyone for listening, and I'll hand you over to my colleague Kirsty Archer, who will give you an overview of the financial position. Thank you.
Hello everyone, my name's Kirsty Archer and I'm the Deputy Director of Finance here at CHFT. I've just got a few slides to show the financial position of the Trust for 2021-22 and to describe the financial plan for the year we've now entered, 22-23. So moving on to the next slide, thank you. So from a financial perspective for the year ending the 31st of March 22, it was a successful year for the Trust in that we delivered a £40,000 financial surplus or underspend compared with our break-even plan. We closed the year with a healthy cash balance of 54.7 million, and we spent less on external agency staff than we'd planned to. It's also worth noting that this is the 3rd consecutive year that the Trust has managed to balance the books and deliver small surpluses. So that's all great news. Whilst we've delivered on these metrics that the regulators monitor us upon, We must just note the support that was provided in year and the ongoing changes to the finance regime that were put in place over the pandemic period. Our actual operational expenditure in the year was higher than we'd originally planned, and this has been supported by additional funding, which in the main related to additional COVID costs, as well as investment in elective activity recovery. These are some examples of where the funding regime was adapted in support of maintaining patient care through the changing times that we've all seen. Additional changes to the normal financial regime that continued from the prior year included a move to block financial payments rather than the historic systems of payment based on the volumes of activity undertaken. And also, we've been receiving cash in advance to allow us to then pay suppliers more quickly and to support the local economy. Other successes that I wanted to highlight are our performance against our use of resources metric. That was delivered in line with our plan. This is an overall score that measures our performance to deliver our agreed plans, our treasury management performance and agency expenditure controls. We were also given an unqualified external audit opinion, and we'll cover this in a little more detail a bit later. The final area to highlight on this slide is our expenditure on assets. That's buildings, IT and equipment, which is known as capital spend. In year, we spent 24.37 million on capital items compared to an original plan of just under 19 million. In year, additional monies were provided for additional spend primarily on digital technology, supporting new ways of working. And investing 24 million in any one year was a huge achievement for the Trust and allowed us to make some much needed improvements to our estate and purchase equipment to support patient care. I'll come on to describe in some more detail some examples of these investments. So if we move on to the next slide. This next slide is a bit of a technical one. So for those of you who've viewed the annual accounts, you'll note that our actual reported position in the accounts is a deficit of 0.3 million and not the £40,000 surplus that I referred to on the previous slide. I've added this slide that just reconciles the difference between the two. The difference relates to technical accounting adjustments. So the revaluation of land and buildings shown there at 0.32 million and other adjustments related to capital grants and donations where we were donated equipment during the pandemic for which there was no cash consideration, for example. There's also a final adjustment for items that were provided centrally but were still held in stock. So these are items such as personal protective equipment, which we've received on a national distribution. Our regulators do not hold us to account against these technical adjustments, and that's why we exclude them when we consider our regulatory performance. Next slide. So as mentioned previously, in year we spent £24 million on additions to our assets. This slide describes some of the more significant areas of spend. And then I've also got some pictures coming up showing the impact of the spend to bring it to life a little bit more. So significant spend was incurred on the estate on our Huddersfield site to improve the condition of buildings and a further 6.5 million on IT projects. And you'll see there some of the range of other items. So on the next slide, you can see some examples of this spend. So these pictures show new theatre monitors, which will help support in our catch-up of elective clinical activity. And on the next slide, here you see our new Learning and Development Centre on the Huddersfield site again. This is a great and much needed development in replacing some old and quite dilapidated facilities that we had previously. And on the next one. And investment has also commenced during the course of the year on the accident and emergency facilities at HRI, which has been very exciting for everyone. Here's an impression of what they will look like, and on the next slide, here's the progress so far. Although obviously this is changing every day. These slides are out of date the minute we take the photograph, but you can see this really starting to come to life. And I'll hand over now on the next slide to Rick Lee, who comes from our audit partners, KPMG.
Thanks, Kirsty. Good afternoon. My name is Richard Lee. I'm a director at KPMG, who are the Trust's external auditors, and I was responsible for the delivery of the external audit for the financial year ended 31st of March 2022. I'll quickly talk you through the 4 different areas covered by the audit and the conclusions that we reached, but I think it's also worth noting that we don't actually perform any work over the quality account, as this is no longer a requirement as set out by the National Audit Office. So, starting with the financial statements, I issued an unqualified or a clean audit opinion on the 8th of July 2022, and this means that I was satisfied that the financial statements were properly prepared in accordance with accounting standards, a relevant NHS guidance, and that they present what's called a true and fair picture of the Trust's financial performance for the financial year. And the clean audit opinion's about as good as it gets from an audit perspective. Our work over value for money assesses the arrangements that are in place for securing economy, efficiency and effectiveness in the Trust's use of resources. And our work covers 3 aspects. So it looks at financial sustainability, governance arrangements, and also what the Trust is doing to improve value for money. I'm pleased to say that we did not identify any significant weaknesses in the arrangements at the Trust. And there's a document called our Annual Auditor's Report, which is published on the Trust's website, which provides further commentary in relation to the value for money work that we performed. I have 2 further responsibilities, the first of which is to review the annual report, and which contains the remuneration report. So again, we concluded this work in early July 2022 and confirmed that the parts of the audit report that are subject to audit were consistent with our understanding of the Trust and the Trust's financial statements. And we also looked at the remuneration report, the areas and the parts of that that are required to be audited, and we concluded that that report was free from any material errors. And finally, as required by the National Audit Office, we're required to check the Trust's whole of government accounts consolidation schedules, and the NAO use this to produce their overall set of financial statements on the NHS as a whole. We completed this work on the Trust and found no matters that were required to report. So overall, clean opinions in all areas. And I'll pass you back to Kirsty.
Thanks, Rick. I'm just going to remember the phrase as it gets. I'm storing that one up. So looking briefly towards 22-23, obviously we're already operating in this financial year. And it is expected to be tough financially. So that reflects both the national context that everyone will be aware of in their own finances, as well as the specific challenges facing the NHS. There's a requirement for all trusts to deliver efficiency savings, and specific COVID funding has started to be tapered down. However, funding has been provided to support and incentivise the delivery of additional clinical activity, and it's recognised that many patients have been waiting for elective care, and so this funding's welcome. Our plan is for a 17.35 million deficit, but this does form part of an overall West Yorkshire Integrated Care Board balance plan. And then the other point to note is that we're also planning for an even greater capital investment programme this year, totalling 39 million, which includes significant continued investment in the new A&E at HRI. Thank you. And I'll now hand you over to our Chief Executive, Brendan Brown.
Thanks, Kirsty. Good evening, everyone. Nice to see you, albeit virtually. Thank you for joining us and giving up your evening. I'm going to canter through some of my slides if I can, as I'm conscious, as Helen said, we're keen to give you all an opportunity to have your questions answered. So I'll get started if I can to give you some context. Okay, this is who we are. We're a large trust. We're considered medium-sized across the country, but actually we're large. We've got 2 main sites, both at Calderdale and Huddersfield, as you know, and we've also got an extensive community service. And I think in all of our conversations, we really do need to realign our discussion to think about our community colleagues who offer a much broader service than just district nursing or community nursing services. We've got a raft of sexual health services been delivered over at Calderdale, and a huge, well, they're not a huge team actually, but they're an incredibly dedicated team of allied health professionals who deliver a range of services within community settings. We're one of the biggest employers across Kirklees and Calderdale, employing over 6,000 colleagues. And as I've said, this is both within our hospital settings in clinical services and non-clinical services, and indeed across the breadth of that community services. And the numbers speak for themselves. They're the patient contacts that we deliver. Those numbers are significant. And I think to Helen's opener, we should remember that that's why we're here. That's why we do the jobs that we do. Our budget, as Kirsty has highlighted, again, is significant, but we have a responsibility to spend the public pound wisely. Can you move my slide on, please, Richard? Okay, so this is, again, breaking it down into facts and figures so we get a true picture of who we really are. I think the numbers are slightly more than on the last slide, but in and amongst all of this, we've currently got 142 volunteers. I think, as Helen alluded to, we really want to engage with you in our communities to increase that number. But look at the numbers, they speak for themselves. Our community are our colleagues are our community. We need to build upon that. But again, just speaking to those numbers, there's a fantastic amount of work taking place across the breadth of the organisation. Next slide, please. Okay, and we have a vision and strategy that reflects the ethos of who we are here at CHFT. And our vision, as it says, is that we will deliver outstanding or compassionate care to the communities we serve. That's based on the 4 pillars that are well established in the organisation. And for those colleagues who have joined this year, what's been reassuring is the feedback from them that they've been able to sense and feel this. And where we don't get it wrong, where we don't get it right, and where we do get it wrong for people, actually we take action in response to that. But we do put the patient first. We do learn from others by going and seeing, and indeed inviting others to come and see the work that we're doing. We do work together to get results, and I think, as Helen called out in her opener, we really do need to think about our role as an anchor partner in the work that we do, taking our strategy forward. And as one of the biggest employers, as I've said, in both Calderdale and Kirklees, by working together, we'll get better results for our patients and indeed our colleagues. And we do the must-dos. Actually, health and social care, for the right reasons, is a regulated service, and we need to ensure that we maintain those standards. We've talked about some of the challenges that we're facing, but we have a commitment, as the first value says, to put our patients first and do the right thing by them. And within all of this, we have one culture of care, as I've said, that you will sense and feel as you enter the organisation, or indeed when you talk to our community colleagues. It's not a strap line, it's not something that we think is pithy, it is genuine, that if we look after our colleagues, we'll look after our patients. If we look after our patients, we'll look after our colleagues. This has to be our priority going forward in the turbulent national context that we all operate in. Move me on, please, Richard. Okay, and as I've said, we're in the process of reviewing our long-term strategy. Anna Basford has joined the call today. The strategy is underpinned by several different pieces of work, but in essence, it's truly about how do we transform and improve patient care across the breadth of our services? How do we keep our bases safe? Have we got a workforce for the future? Our workforce, and you'll see this in some of the national news, the NHS workforce is seen as a challenge. I see it as one of our greatest opportunities, but we are challenged by the workforce numbers in the same way as most organisations across the country. But our workforce will make us successful, and we need to hold on to that. And again, we need to think about our sustainability. That isn't just about how we remodel our services or indeed transform them or indeed reconfigure, but are we truly sustainable in the context that we're operating in? Okay, keep me moving on if you can. Okay, and it's important to just call out how we have transformed and improved patient care. We've got a raft of colleagues, as I've said, in that 6,500 I think they're very bashful, actually. They just quietly get on and deliver. But this just speaks to some of the national awards that our colleagues have won, either in clinical or non-clinical services. And we don't take any of this for granted. Some of this has been led by our colleagues who have seen a problem or a gap or an initiative that they wanted to solve, and they've got on and done. I'm pleased to see that some of their work has been recognised through the national awards that we've highlighted here. Okay, keep me moving on. Okay, and how do we truly keep the base safe? I think, as colleagues have called out, we've all lived through, at a personal and professional level, one of the most challenging 2.5 years of any of our lives. None of us could have anticipated a global pandemic, and all of our services were disrupted by that. And we're now in what is commonly known as recovery. So we'll talk about the elective recovery period. We'll talk about our financial recovery. We're actually still in a pandemic, but recovering from the impacts of what's been a very disproportionate phasing of this, both in the north compared to some of the south. But if we look at where we were in wave 1 to wave 2 to where we are now, the world has changed around us. So as part of this, we need to get back on track. And again, I'm pleased to say that the colleagues I've been referring to have gone all out to do the right thing by our patients, doing the right thing for the right reason to get the right results. We don't have any patients waiting more than 2 years for planned care. We have 175 patients waiting over 78 weeks, but with a target that we're set to meet to have that at 0 by March 2023. For those patients with a target of a year, we've got actually 1,909 who've been waiting over 52 weeks, up to 52 weeks for treatment. But again, our target, and it's an ambitious target, will be that those patients will have received their treatment by March 2023. And in this, we have led the way on the work. And again, it's a credit to colleagues who are on the call, and indeed colleagues who have moved on to other organisations around the work that they've led on around narrowing the inequality in our waiting list for patients with a learning disability to make sure that there is parity of service. We've looked at how we use the indexes of multiple deprivation around our health inequalities agenda, and that again has been nationally recognised, but we're not complacent about that. There is and always will be more work to do. But again, I'm pleased to see the work that's been led by colleagues in the organisation to tackle those inequalities and to make sure that we challenge any inequity that we see going forward. We've got further work to do with our partners, and again, I think we've got some fantastic partners across Kirklees and Calderdale who are engaged in working with us on this. Our Macmillan Information Support Team and lead cancer nurse won the Macmillan Professionals Excellence Award. Again, we have to call that out. In and amongst the challenges that we saw as we very quickly went to remote working, our team's work was recognised, and I think that absolutely should be called out. One of our district nursing, well, our district nursing team, they were one of the first trusts in the country to offer COVID treatments to clinically vulnerable patients in their own homes. Again, we shouldn't underestimate just how hard that was, but again, it was a team that just got on and did it, and doing the right thing for the right reason. You will have seen the national attention that has been paid to maternity services up and down the country, and this is in response to incidences in hospitals that have been across the headlines. We need to learn from that. I'm pleased to see the work that is taking place in our maternity services for the women and families that we serve. And there have been several reports to board detailing the work that we've taken forward in response to Donna Ockenden's report. And there is learning from the first report, and there is learning from further reports that are coming forward. But we don't take any of this lightly. We have a commitment to do the right thing by the women that we serve, and I'm pleased to see the response that our maternity services have led upon. Okay, next slide, please. This is how we break down our workforce. As you can see, the gender split is called out at the top. 82% of our workforce is female and 18% are male. That's that. I'll leave that to discuss. And then I've broken down just so you can see the numbers in detail from staff groups. Okay, move us forward, please. Okay, and in that, as I've said, our workforce, I truly, truly believe, are our solution, and they're our ambition, and they will take us forward. We've had significant challenges in recruiting, predominantly our nursing, maternity and medical colleagues, as most organisations have across the country. But again, I'm really pleased to see the work that people have taken forward. If I think about our emergency department, Lindsay Rudge is pleased to confirm that those nursing vacancies will nearly be at zero, I think, by the end of October. I mean, that's great news. But we're not complacent. It's not just about recruiting people, it's also about how we retain our people within that one culture of care. Our facilities, our wholly owned subsidiary, which runs mostly our facility services and a breadth of others, I'm probably doing them a huge disservice, but actually we're named as one of the Kirklees top 100 companies. And again, I think that's a credit to Stuart and the team for the work that they've done in leading that wholly owned subsidiary and taking business forward, making sure that work and procurement is locally driven. Again, I know they've got lots more ambition in how we take that forward, and there's work that's already taken place across Calderlow and Kirklees with local industry and indeed with partners to think about how we better use the public pound and have strength in our spending ability. Kirsty's talked about the finance position, but in and amongst all of that, our finance team received the Future Focused Finance Accreditation, which should not be underestimated. This speaks to the culture within the finance team, which I would say Gary and Kirsty have very ably led, and I'm pleased to see that that accreditation is a recognition of that work. We've got 4 professional nurse advocates in our community division. They are the first 4 in community setting, and again, credit to them for the work that they do, and credit to our community leaders for investing in that work. Liz Morley, Sally Akerson and Ansa Jami will not thank me for this, but we need to call out the fact that they were recipients of the Queen's Nursing Award, which is not an award that's given out readily. Again, it's a credit to the work that they've taken forward across our community services. And again, it would be remiss if I didn't call out the work that Suzanne and her team have led on with Project Search, which is an intensive supported intern programme for young people with special educational needs. Again, I think our workforce and organisational development team should take credit in that. I'm going to keep us going. Okay, again, talking to the sustainability plan, I've mentioned this earlier, this isn't just about the reconfiguration of our services, it's about whether we are a responsible and sustainable organisation. Kirsty's talked about the financial elements of this. Stuart is on the call, and again, thanks to Stuart and the team, there's a green plan being developed within the trust, which has been recognised for its work around climate change and identifying the key issues that we need to take forward. We do have a sustainability action plan. Again, I think there's 74 out of the 176 actions already complete, but there's more work to do on this. And again, it's something we're committed to in our current environment and as we reconfigure services. Okay, keep me going if you can. Okay, and this is why our community are huge advocates for us, and we cannot underestimate or thank them enough for their support. But it speaks to the work of our charity and again our local communities who have truly supported the work that we've taken forward for our patients and indeed our colleagues. Next one if you can. So looking forward, there's lots of exciting things happening in this organisation and we should be proud of that. It goes without saying that our focus will be on our patients and their families, but it's also going to be about our colleagues' wellbeing and resilience. As I've said, we've all gone through the strangest of experiences in the past 2.5 years, and it continues to feel a pretty febrile national and international context that we all live in. We need to think about that and think about our colleagues' wellbeing within the energy crisis that everybody is facing and indeed the global environment. So recovery I've talked about, we need to keep abreast of that. I'm pleased with the ambition that colleagues have demonstrated, but we're not taking any of this lightly, and there are risks to our delivery going forward, but we will keep a foot firmly on the gas with all of this. And as we talked about, Renee talked about some of the exciting developments that are taking place around new outpatient referral models, virtual wards, and Rob Burkett's on the call. I think we've got some great ambition around our digital ability and what's next for us. Okay, keep me going. Again, our estates, we've talked about this. I'm probably going to get to some of the pictures just to re-emphasise this. If we can go forward. Thank you. I can't emphasise enough what we've done. That new emergency department will be on completely the other side of the HRI. The roof is already on. We are halfway through a reconfiguration. And again, we can't underestimate the opportunity, which was probably once in a lifetime, to rebuild a hospital. And again, Anna and her team have done a huge amount of work on that. Again, we want to make sure our communities are engaged in how we deliver those services. Kirsty called out the Learning and Development Centre, because again, this is absolutely about our commitment to our colleagues working in modern and state-of-the-art facilities. Okay, keep me going. Okay, and the Rainbow Child Development Unit moving to Ellen shortly. Again, standalone state-of-the-art facilities that have been designed and inputted from our service users, hence the puppets to signify that. But again, great developments, credit to the team for the work and the planning involved in this. And again, it speaks to the start of our reconfiguration of hospital services. And I would argue some of the work that we need to do about recognising the work that our community teams have taken forward in how they've reconfigured the services they deliver. Next slide, please. Okay, and this is what it will look like. This is who we are going to be. This is really exciting. It will be challenging, and there will be opportunities for further input into how this can and will operate, but this is what we can offer going forward. And again, I'm hugely excited by the work that's taken place on this. Okay, I'm conscious I've tried to rattle through that so we can get to questions. I'm about to hand over to our chair, Helen Hurst, to take that forward. Thank you.
Okay, so thank you very much, and thank you Brendan and Kirsty and Rick and Stephen. And in particular, thank you to Renee and Liam, who have stepped out of their day jobs today to bring some of their service areas and developments to life. So I'm going to crack straight on to questions because I know we're going to run short of time, and I'm going to hand over first to Suzanne Dunkley, our Exec Director of Workforce, who is going to take the first two.
Thanks, Helen. Good evening, everyone. As Helen said, I'm Suzanne Dunkley, Director of Workforce and OD here at CHFT. We've spoken about One Culture of Care already, but that runs through all of our people strategies and our people-related activity, including recruitment, retention and colleague engagement. Liam's already taught you through some of the great work he's leading on from our recruitment strategy, and the focus of that strategy is about growing our own, which includes widening access, developing and supporting colleagues, and focusing on any areas of concern for retention. So just some of the things that we're doing to grow our own. We've got the creation of the new entry pathways that Liam taken us through. We're supporting members of our local community to progress into apprenticeships and substantive posts and also be volunteers. We're building a great pipeline of nursing graduates by working with our local universities and colleges. And we're expanding our international recruitment as well to welcome 100 international nurse recruits in 2022. Once we've got them, we'll develop them, and we hope that they stay with us. We're also looking at the pastoral support that goes around that, and because of the success we've had with our international recruitment, we're now extending those programmes into midwifery and also allied health professionals and community nursing. We have a 0 vacancy target for healthcare support workers, and we are achieving that. And we're also looking at rolling out some wider leadership and management development programme activities, which include clinical director development programme to attract and retain clinical leads for each specialty, allowing colleagues to build their clinical leadership with CHFT. On to the next slide, if you could, please, Richard. So in line with One Culture of Care, we're making sure that colleagues can be open and honest whilst working for us here at CHFT, and we use several measures and several indicators to check that we're doing that, including our quarterly people survey and our annual staff survey. We've also got freedom to speak up processes and workforce health indicators such as turnover, absence, training and appraisal compliance that monitors the health of our workforce. What's great about these questions is it allows me to shout out about the great things we're already doing, but also the things we're working on to improve. We compare really favourably to other trusts on a lot of these indicators, including turnover and compliance rates, with a turnover just over 8%. I do want to give you some very specific measurements, however, from the most recent People survey, which is carried out quarterly, and that shows an improvement in the number of colleagues who look forward to going to work, which is up by 7.1%. A further improvement in the percentage of colleagues who believe CHFT proactively supports their health and well-being, and to note there our score is 7.6% higher than the NHS overall. There's a lot of work gone into that. Colleagues believe there are frequent opportunities to show initiatives in their role, which is up 2.3% from last quarter. And our areas for development include how colleagues believe they're supported by other teams, which at 70.6% is down 5.8% on last quarter. From our last annual staff survey, again, we've got some great areas of success. I just want to give you a couple of examples of those. My organisation takes positive action on health and wellbeing, saw an increase of 28% from 2021, and this improved from 22% in 2019 to 60% in 2021. So there's been a huge improvement there. Opportunities to show initiative has increased by 2.8%, and really important for me under freedom to speak up, 76.1% of our colleagues would feel secure raising concerns around unsafe clinical practice, which is up 5% from 2019. Where we need to develop will not be surprising to you. All trusts are facing the same issues, but there's questions around often always look forward to going to work needs improvement, as well as often always feel enthusiastic about my job and enough staff at my organisation to do my job properly. In the last 3 months, also people have felt that they have had to come to work whilst they are unwell in order to support their colleagues. There's a couple of things we're doing improvement to address that, which is our refresh people strategy, values and behaviours, which we've talked about. We're challenging every team across the trust to develop their own One Culture of Care charter, and One Culture of Care is mentioned in all of our meetings under We Put People First pillar. We've hosted a trust-wide wellbeing festival. We've appointed 150 wellbeing advisors who, as well as their day job, support colleagues over the phone, walk around on site. We have two appreciation events this year, including one that we're smack bang in the middle of now. And we also have been developing our financial care package to colleagues with salary finance support. We've also launched a trust-wide development programme which focuses on compassionate leadership, empowerment, stepping into leadership and all those management essentials that our colleagues need. As we are in Appreciation Week, I'd like to sneak in a quick thank you to all of our colleagues, partners and attendees this evening for everything that they do for me and my family as a colleague and both a patient. Sorry that was a whip through, but back to you now, Brendan, to answer some more of the questions.
Thanks, Suzanne. So a colleague had asked how often do we go out on wards and departments? I think it's more than wards and departments to speak with our colleagues. I can arguably say I can speak to someone every day or nip to a clinical or a non-clinical area. It's important, but there isn't this isn't a royal visit or a roll out the red carpet or indeed something we do with the comms team around us. That isn't how we do things here. It's about going in and checking in with colleagues to see what it feels like, to see what their problems are. I can talk to you about a conversation I had with one of our healthcare assistants about patients waiting for transport yesterday. Helen and I met Debbie Wolf in Community Services today. It's more than just the visit, it's the checking in and talking to folk. But I want to make sure, for instance, our colleagues in CHS, Holderdown and Huddersfield Solutions equally get access to us. It can't all be about the clinical departments. I think there's other things we do as well. So we've got an Ask the Chief Exec. It's called an Ask Brendan facility where people can pop in any questions or issues that they've got so we can make sure I can get a response to them. And we've also got what we call CHFT Live, which is run every Wednesday at 1 o'clock. And that's a conversation between the directors and indeed our 6,500 colleagues. They can ask us anything on that. We give them usually an operational and a clinical update, and again discuss any hot topics or or respond to issues that people have raised with us. But again, real opportunity for people to talk to us and raise their live issues. And again, there's also, I think, as I've called out, there's other opportunities. So I'm currently the chair of our race equality steering group and our wider network group. So there's opportunities to talk to every member of staff. I can't get to all of them, I'm afraid, because there are 6,500 of them, but we do endeavour. Helen, did you want to add on?
Yeah, so obviously I've been here 3 months, and part of my induction has been trying to meet as many people as I can. I'm also trying to avoid the sort of potential eye-rolling moments when the chair comes to visit. So again, trying to do it as much more of a, you know, about while I'm here. So for example, you know, I've been on the shuttle bus a couple of times from Huddersfield over to Halifax, and actually just doing that and chatting with people en route, participating in the appreciation week. So we took appreciation week to people yesterday. I went with a colleague from Workforce and OD, Paula, and we, you know, that felt a bit more natural, I have to say, than sort of formal visits. But again, real good opportunity, you know, picked up some issues from people, brought them back, talked to execs about them. So I'd rather do it naturally myself than a sort of like sort of mini little sort of staged visits, because that's much more my style. But I'm very keen to meet people, and I'm open to offers. You know, anybody who wants me to go and spend some time in their services and understanding and looking at what they do, I'm really happy to do that. Okay, shall we move on to the next question?
Okay. Thanks, Helen. So we've had a question about why have we complied with the mask and vaccination requirements. There is a comment around the reality of this. I'm going to stick to the facts as we know them and as we've lived with them over the past 2.5 years in respect of our colleagues and indeed our patients. We've followed national policy and guidance around infection prevention and control, around the personal protective equipment that we've used. The vaccination programme has been in play for a significant period of time now, as you all know, but again, it's something that where there is a personal choice for colleagues, and we do have strict precautions in place to ensure the safety of those COVID-19 vaccines. I think going forward, we have today made a decision around reducing some of the restrictions around mask wearing in non-clinical areas, but based on the fact that the numbers in our inpatient beds have started to increase again, this is something that we will keep a watching brief on. Thanks, Helen.
Okay, well, I think we're now moving on to Stuart, I think, with the next question.
Thank you. We've had a question about improving hospital food by sourcing food locally and working with local farmers based on an initiative that's taking place at Sheffield, and asking about how we're dealing with it. So I can thank you for this question. We are aware of this initiative, and as an aside, the questioner may have listened to a really good programme on Radio 4 at the weekend on this topic, specifically about delivering really good hospital food and best practice, which we're exploring further. So I can confirm we are working with local suppliers. We are working on a catering strategy, and that will ensure our contracts will be delivered by small, medium enterprises. We're also engaging with local suppliers currently to establish the best route to market for them. And this is part of our green plan. We're working to reduce our food miles. So we already use local suppliers, as I've said, to source food. We also use them in our retail outlet, for example. We're using local cash and carries. And that's in an effort to use local suppliers, but also reduce our food miles and to keep the spend local. So we're always exploring different ways to expand this. And again, I'm always really keen to speak to local companies and how we can work with them going forward in the future. I'll hand over now to Anna, who's got the next question.
Thank you very much. Hello, everybody. My name's Anna Basford. I'm Director of Transformation and Partnerships at the Trust. And the first question that I'm just going to provide a response to is in relation to a query about how can we make sure that people who live in Calderdale are offered their outpatient appointment at Calderdale Royal Hospital, as that makes things much more straightforward in relation to travel.
So by way of response to that, what I can say is that we do offer outpatient appointments at both of our hospital sites, and we do seek to offer a choice for patients around that, and therefore that it would match, that it was the site closest to where people live. However, that's not always possible for all specialties, and may not be possible in particular if somebody needs to be seen quickly and the quickest access to that appointment may not be at the corresponding site. But as I say, we do try to do that. So turning to the issue around travel, if people do have to travel across, I just wanted to provide some update in relation to that. People are probably aware there are local bus services routes that do run between our two hospitals, an hourly service during daytime hours. The Yorkshire Ambulance Service has also launched a transport options helpline, which provides information and advice about how people can access other forms of transport. Sometimes that might have a charge, sometimes it might not. But what we can also say that for those people who are on low income, they are able to claim the full costs of their travel to healthcare services. So I'll move on now to the second question that has come in. Thank you for moving that on for me. And this question is in relation about what are we doing to improve access to services in the Upper Valley in Calderdale, including making best use of some of our facilities in that area. Now, the response to this does link back to some of the presentation that Renee provided at the beginning of this meeting, because what we've been doing is we've been working very closely with local GPs in the Upper Valley, with social care providers, with voluntary sector, and we've implemented a number of new services. And that includes the urgent community response teams that Renee described, which is to be able to provide people with within 2 hours a response in their own home, which brings care and to them without the need to travel and into the Upper Valley. We've also been working with local GP practices around providing additional roles, working alongside practices to anticipate people's needs, and that includes assessing what kind of support they need and then being able to provide that into their own home. So again, that's been developed in the last year into Calderdale. And we've also been working with GP practices to implement improved access to musculoskeletal services for people to be assessed and to receive treatment, again, in the Upper Valley, close to home, around their GP practices. One of our aims is to try to provide as much service as possible closer to where people live. Not just in the Upper Valley, but generally as a principle, but that has been implemented. As Rennie referred to, we will also be implementing a virtual ward model from October, and that again will improve access in the Upper Valley. And we continue to offer different forms of accessing treatment and advice and support using digital technology where that's appropriate. We know it's not right for every form of treatment and support or consultation, but it can mean for some people it's much more convenient without leaving home. We are reviewing the best use of our estate across our community facilities, and as Brendan's referred to today, and how that sits alongside some of the developments on our hospital site, and that will include the ongoing review of the increased and appropriate use of our Todmorden Health Centre. So I'll move on to the next question now, my final question that I'm responding to this evening. And this is a question that has been raised in relation to some of our planning linked to our reconfiguration of services. And this is particularly in relation to a query from physiotherapy services about how services will be delivered on the hospital site when we reconfigure. And in terms of responding to that, what I will say is that we are currently, as we're moving forward and as we've outlined, we're well into an implementation phase around building and design of some of these buildings. We are increasingly working with services around understanding the detailed operating models, and that will help us to inform the best use of those buildings, that we get the right adjacency of services, the best co-location, and we really fully understand the estate requirements both in and out of hospital. So as part of that, we are talking about the future provision of outpatient services, about the best way to deliver therapy services, and how we do that in a way to improve access and support, and importantly, the right environment for colleagues to work in to deliver services. We are at the start of this conversation in that phase of work, and we are very happy to and will be meeting with the therapy teams to discuss that in more detail. I know they have a number of queries, and I have already confirmed I'm very happy to meet, so we'll be doing that in the coming weeks ahead. So I'm happy to hand over now back to our chair, Helen Hurst. Thank you very much.
Thank you very much. So we've got 2 minutes left. So I don't know, we've got a couple of questions that came in the live Q&A. The first one was around whether, while readmission is reduced, is there an increase in mortality in the same target population? And the second one was around the timeline for the completion of the new developments. Now, we can give a full response, but I don't know if Brendan, you're able just to give us a 30-second response to each of those.
I will. I'll do 30 seconds. David Birkenhead, our medical director, is in the audience, but not able to just log in. So I won't put it quite as eloquently as him, but our mortality data is still within normal ranges at this point. We haven't seen any variability at this point, but it is something we're paying attention to. We are seeing an increasing number of acutely unwell patients admitted and readmitted, and it's something we're working with public health on. There is something coming to our executive board next month to do an ongoing deep dive into our mortality data, but we are still within the expected range, but it's something we're paying very close attention to, as you would expect us to. And then I think Alok has asked about the completion for the new developments. Alok, if you email either myself or Anna Basford directly, we can go into detail with you on this. But the ED department, often known as an A&E department at the Huddersfield Royal Infirmary, will be completed of summer next year, and we will start some of the building works, predominantly with the car park over at Calderdale from March of next year. But again, contact us both by email and we can go into detail with that. And a colleague who asked about the mortality data, or a member of the public, again, if you make contact with us, we can give you any further detail that you need.
Thank you very much. And there was a third question in there which has been answered directly by Suzanne, in terms of how people who are interested in finding out more about the apprentice programme can get in touch with us. So I think we have managed to cover all of the questions that we've been given. So at this point, I'd like to formally draw this meeting to a close. Thank you everybody for attending, and particularly thanks to our speakers this evening. And, you know, in what is our Appreciation Week, specific thanks, I think, and special thanks go to Amber and Andrea, who do all the stuff behind the scenes to make this going as smoothly as it possibly can. So thank you to you two, but also especially to Richard, who's doing all the tech support behind this. And this isn't his job, I found out today. This is something he does as an extra. So thank you ever so much for that. That's brilliant. And again, hope you have a good evening, and thank you again for attending. Bye.